Hi, my name is Dr. Steve Miners of Rehab Effects in Austin, Texas, and today we'll be discussing the Adjustor. The Adjustor, as we discussed in the previous segment, can be used in lieu of a chiropractic adjustment. Normally, when we perform the chiropractic adjustment, let's say on the lumbar spine, the patient is in this position and we are providing a thrust through this hand into the lumbar spine or into the sacroiliac joint, right there. And some patients may just be uncomfortable with that. So we can offer them the Adjustor. So we would have them lay on their stomach and we would use the Adjustor, and the Adjustor has makes a little noise like that, and as you push in, it makes that kind of a noise. Now, for those of you that think that this looks a little daunting, if you push too far, it actually stops. So therefore, relatively no harm can come to the patient when you do this. So this is how you would actually do it. You would find the area that you are looking to adjust, which may be the lumbar spine right there, and lumbar spine's right there, and you are performing an adjustment just like that.